My name is Mankirat.
And I'm Rachel Carson.
And we are the co-hosts of the Muscle Health Research Center, also known as the MHRC podcast series
at York University Faculty of Health. On this podcast, we interview students, professors, and industry partners who bring unique and valuable insights. From cutting-edge scientific discoveries to behind-the-scenes experiences in the lab, we explore the work and the people driving innovation in their fields.
Our goal is to highlight not only the science, but the passion, challenges, and the curiosity that shape the future of human health. Whether you're a trainee, a researcher, or simply someone curious about the science of movement, you're in the right place.
All right, let's dive into today's podcast.
Hi, everyone. I am Mankirat, your host. And again, behind the cameras, we have Rachel. Welcome back to our second episode of the Muscle Health Research Center podcast. We're so excited for our second guest today, Lauren Turner. How are you?
Good. How are you?
We're good too. Thank you for being here. So we'll just dive right through. So please tell us about your background.
Yeah. So pretty much, at least in terms of research, I kind of started off at McMaster University, and that's where I did my undergrad in kinesiology. And then when I was there, I met my current supervisor for my PhD, Dr. Mike Riddell. And I was in a lab studying diabetes, and he came in to be a participant, and that's how I met him. And he was nice enough to take a chance and take me on as a master's student. So I've been at York University for the past couple of years as a master's and now PhD student in his lab.
Awesome. Thank you so much for sharing that. And I know that you mentioned that your research is regarding diabetes. I know that we have a lot of listeners who might not know the difference between like type 1 and type 2 diabetes. I know there's a lot of misconceptions regarding those types. So could you please help to clarify that?
Yeah, it's a great question. I always tell everyone I had this question on like a test or an exam in undergrad, and I got the question wrong because I didn't even know initially. But type 1 diabetes, it's an autoimmune disease, which basically means the body kind of attacks itself and attacks its own cells. And what it does is it attacks these cells called the beta cells of the pancreas, and these cells make insulin, and insulin's really important because it helps us uptake sugar into our muscles that we can use as fuel. And without insulin in type 1 diabetes, you can get really, really sick because your blood sugar goes really high, it's uncontrolled. So you rely on insulin needles or insulin pumps to kind of help manage that. And then type 2 diabetes is your pancreas still produces insulin. It's not your body's autoimmune cells or anything like that. You're still producing insulin. It's just you're less sensitive to the insulin that you're producing. And so because of that, you also can have high blood sugars. But typically it's managed not with insulin, but instead with other drug therapies like metformin or Ozempic is really popular these days to try to.
Awesome. Thank you so much. So what type of diabetes does your research specifically focuses on?
Yeah, my research for the main part focuses on type 1 diabetes. That's what our lab's more or less centered around, at least in terms of human research. And I'm interested in that because I live with type 1 diabetes, but we do dabble into the type 2 space as well. And I think they're pretty interrelated in some ways. You have similar technology use between the two types of diabetes. So we kind of look at type 2 a little bit, but focus on type 1.
Awesome. Thank you so much. And I know that you already mentioned why studying diabetes is a bit important, but could you provide us with some more insight? And could you also help us to learn how can exercise play a role in regulating diabetes?
Yeah, it's an important question, at least in terms of type 1 diabetes. If you look just across Canada, there's almost 300,000 individuals living with type 1 diabetes, and type 1 only makes up 10% of diabetes cases in total. So that's 300,000, but there's a lot more living with type 2 diabetes. So from a healthcare perspective, at least within Canada, it's really important that we try and manage these diseases because we know that large fluctuations in blood sugar over an extended period of time, these are typically lifelong diseases. So as people live with these for a longer period of time, you get more complications like heart disease or kidney disease, and it ends up with individuals in the hospital. So it puts a strain, of course, on the individual, but also on the Canadian healthcare system. And so, like I said before, insulin, metformin, all those are important in treating diabetes. But then exercise is also a really important way to help manage blood sugar. When you exercise, you can think of insulin almost like a lock and key. Insulin goes to the muscle, and it kind of acts as that key that opens up the doors that allows sugar to be brought in. But exercise does that on its own, independent of even exercise. So when we exercise, we can help bring sugar from the bloodstream into the muscle. We can help better maintain glycemia. And so that's why exercise is so important, among other things. Everyone should be exercising.
Awesome. Thank you so much. And yeah, really great insights. Awesome. So for our last and final question, if you don't mind me asking, what are some of your new recent findings? And how do you think your findings could be applicable to the general population?
Yeah, so we know that even though we want everyone to exercise, it's just not happening. I mean, I can't get out for an hour run every day. I doubt you can either. It's just that your day gets away from you. So we've been looking at kind of exercise snacks or short bouts of activity that people can do, short walks around mealtimes, for instance, or even just trying to hit 7,000 to 10,000 steps per day. And we found in individuals with type 1, hitting those, 7,000 to 10,000 steps per day can help improve glucose management. So that's one of our studies. And then we've even looked at individuals with type 2 diabetes, looking at walking before dinner and after dinner. And that one was just accepted for publication. So stay tuned. It'll be out soon, but not a huge surprise. But walking before and after meals also help manage glucose, and that was nothing else. No other habits are changing, no medications are changing, so it's just really simple lifestyle habits. Everyone can get up hopefully every 30 minutes for a quick walk. So that's kind of where we're heading now in terms of diabetes and exercise research. At least I am for my thesis.
Wow, that's actually really interesting because every time you think about exercise, you think that you have to go to the gym and lift weights and you do all this like heavy exercise, but even just like a short walk can help to improve your insulin levels and help to kind of reduce the risk of diabetes. So that's really cool. Is there any like last words that you would want to give to your audience in terms of how they can exercise and decrease their risk of diabetes?
I think just small, short bouts of activity. Get up, move a little bit throughout the day. Go for a walk outside, get some fresh air. I think a little bit of movement's better than none.
Awesome. Thank you so much.
Thank you.
So this is the end of the second episode of the podcast. Thank you so much, Lauren Turner, for being here. Thank you, Rachel, behind the screen, and we'll see you next week. Thank you. Bye.
That wraps up today's episode of the MHRC podcast.
Thank you so much for joining us today, and a special thank you to our guests for sharing their insights and experiences.
If you enjoyed this episode, be sure to follow us on Instagram, LinkedIn, Facebook, and YouTube so you never miss future conversations.
And to learn more about the Muscle Health Research Center and the work happening here at York University, including our upcoming events and resources, check out our channels and stay connected.
Thanks for listening, and we'll see you in the next episode.